Hi, my name is Olga Sirbu. I'm a board-certified behavior analyst and licensed behavior analyst. And in this video, I'll talk about low-demand parenting, sometimes recommended in ABA therapy for the children with pathological demand avoidance, or PDA for short. But before we start, as always, I would like to encourage you to put a like on this video and hit the subscribe button below so you can benefit from weekly information on the subject of autism. I talked about pathological demand avoidance, or PDA for short, in one of my previous videos. That's why I will not stop to explain this term again, and I will move straight into the subject of low-demand parenting. Disclaimer here, the provided information in this video comes from my personal practice as a BCBA and from the parents that I've been working with. Low-demand parenting or no-demand parenting is an intervention usually recommended to parents with children on the spectrum that are meeting the criteria for PDA, meaning they are engaging in problem behaviors such as distraction, escape, flopping, elopement, or aggression whenever a request is in place. Low demand or no demand does not mean that the parent will not have rules, routines, and let the child do whatever they want. Low demand parenting is about creating the illusion of autonomy. How do we do that? Key to all the following elements that are part of low demand parenting is how we phrase it. As a parent of a child with aversion and resistance to demands, I will suggest you to use first, then language in a way that does not sound like a demand. For example, after we finish homework, we can have TV time. This is a statement sentence that informs the child about the sequence of events and consequence. First, homework, then TV. Automatically we deliver and the information of what can happen if the child does not complete the homework, which is not having TV time. Second, add choices in your everyday interaction with the child. Here you can use real items, objects for choices, or a choice board. For example, if we tell the child, put your shoes on, we may bump heads with the child, and the result will be a panic or meltdown. But if we phrase it, what shoes should we wear today? Black, brown, or blue? We are giving the child the sense of control, and as a result, the child may choose and put on the desired shoes. Third, use statements. Sometimes you may tell the child, what shirt do you want to wear today? Red, green, or white? And the child may respond that I don't want to choose. So, in this case, that the choices don't work, we need to use simple, clear statements. It's time to get dressed. Fourth, use visual schedules. This strategy may work with some children and may be very stressful for others. Some children like to choose the pictures with the desired activities and place them on their to-do list. For others, this may be a source of frustration and meltdown. It's your decision as a parent to find out the strategy that fits your child the best. Fifth, use reinforcement or motivators, the things that your child loves the most. For example, if you want your child to brush their teeth, you will avoid saying, go and brush your teeth. But you may add a reinforcer in the picture and say, after we brush teeth, we can watch Cars or Blues. This will not sound like a request and will motivate the child to brush their teeth. Sixth strategy, attach demands to objects or a high power. It's not you, the parent, who makes the rules or has demands, but the objects have their rules and demands. Playing with toys comes with putting toys away. Eating a candy comes with throwing the wrapper in the trash. If you have a dentist appointment, then you may present it as something that no one has control over it. It may sound like something along those lines. It turns out we need to go to the dentist. I don't want to do this either, but we have to. 7 and last, do not use the second person, you. Probably you noticed that in all my examples I did not use you need to brush your teeth, you need to get dressed, or you need to do your homework. But I used the plural of we. After we do our homework, we will watch TV, or we have a dentist appointment. By using we are not delivering an authority message to the child, and we are showing them that we are not having control. I hope this information clarified the low-demand parenting concept and will be helpful to many family interactions. Please leave your comments below this video, and I will see you in the next video.